Hey, it's NASCAR champ Joey Logano here, and I know everyone has so many questions these days about COVID and the vaccination shot. And I thought, boy, I have a lot of questions as well. Who better to ask than Dr. Charles Prober from Stanford University? Charles, how are you?
I'm great, Joey. Great to meet you, and thank you very much for teeing up this conversation. I'm very interested in answering all of your questions and trying to assure your fans and yourself about the vaccine for COVID so we can get out of this pandemic. You're right, I'm here at Stanford University. It's virtually depicted in my background. I'm a pediatrician by training, so I take care of children, and my subspecialty area is infectious diseases. So specifically children with infections that I've studied all of my professional career. And I've been very involved in discussing this pandemic, COVID, highly unique, a once in a lifetime experience, and very interested in your questions. And I hope I can answer them to your satisfaction.
Well, thank you very much, Charles. And I think, probably the first question that I would ask is just, what is the oversight you think of vaccines? I think everyone has probably the question of, okay, there's three different kinds. What kind is the best for me? What are the risks that are involved? What are the side effects that can be? What does it, what does it cover? How often do I, like, just so many, it's so many questions that just keep running to your mind over and over again.
Right.
And it's something so new, right? It's something that is just new, right? It's been rushed through the system, right? We got to get it out there to stop the pandemic. I totally get that. But at the same time, it's natural to be a little bit worried because we don't know the common people like myself that aren't as smart as you don't know the truth and don't know the research behind it all. So what is kind of your overview of the vaccine and what direction people should go?
Well, thanks for that, Joey. So that the COVID vaccines, in my opinion, and this is after decades of infectious diseases, are almost a miracle in terms of how rapidly they've been developed. And we'll talk about how they're safe, yet rapidly developed, and what they are going to be able to do and are doing in bringing this pandemic under control. I'm of course, because I do infectious disease in children, I'm a big fan of vaccinations. And as you likely know, there are many diseases for which vaccines have developed over the decades, even the centuries, that are very important across the world. There are now 28 different diseases that vaccines can help to prevent around the world. I know you've got two young children and they've probably received protection. Your younger one, I understand just going to be one, has received protection with vaccination from 14 different diseases or viruses or bacteria that could have caused significant problems. And your older guy may have had a couple more. And if you look just at vaccines in general, it is estimated that they prevent somewhere around 2 to 3 million deaths, prevent 2 to 3 million deaths around the world each year. Sadly, there's still deaths caused by those vaccine preventable diseases because the entire world doesn't have access to them. And so, but let's come to, and you're correct that many of those vaccines took quite a while to develop. It took us a long time to figure out some of these, from the very first vaccine, which is smallpox way back in the day, and that's now an eradicated disease, to some of the more recent vaccines. COVID was done more quickly for a number of reasons. First of all, the urgency could not have been greater. There has never been in my professional lifetime an infectious disease which has come on so rapidly, spread so quickly, and caused so much disease than this particular virus. So the need for a vaccine could not have been higher. The other thing which drove the rapidity of the response was that the United States and other governments poured bucketfuls of money into the problem. As you know, billions of dollars. And collaborations were developed across the United States, from government agencies to universities to companies, and then around the world, all putting their efforts together. And the final thing I'll say is the technology, which we can get into if you wish, that underpins the development of these vaccines was under development in different ways for over a decade. So the technology, the so-called platforms, are not used, but their application to this rapidly emerging problem brought everything forward. So, and I can provide you assurance about the process that went into develop them rapidly, but the short answer, I've just given you a long one, I suppose, but the short answer to the question is these vaccines are truly incredible.
And you feel that all of them, you know, I guess something that we all do, right, is we turn on the news. We turn on the news and wonder what's going on. And you can turn on one channel and hear one thing, and you can turn on the other channel and hear something that completely contradicts what the other channel just said. So I think what we all probably feel a lot of times is what's the truth? How do we come up with a way where someone can get more of a factual, more consistent answer, I guess, where you feel like you know exactly what the risks are, exactly what the benefits are, so you can make an educated decision. I think that's where I think it makes it so hard for me personally, or probably millions of people watching this, saying, how do I make an educated decision if all the data is different than the other? It makes it very challenging.
So I understand that dilemma completely, and it's a dilemma which has grown so rapidly as the internet and social media has grown. So you can get pushed or you can pull information from so many disparate sources, some of them which I guarantee are highly reliable, and some of them I guarantee border on dangerous. And to be able to sift through and find where the truth lies, I understand completely that that's an issue. And so I'm going to do an analogy, which I'm sorry if it's trite or naive. I know nothing about cars. That's really, to say to a star NASCAR driver in your fans is maybe, well, it's probably not surprising, but I probably shouldn't be saying it. And if I have a problem with my car, and I haven't tried this, go online and try to find a solution, I bet I can get a whole bunch of weird stuff. And I actually probably don't know how to apply actually the true stuff. So maybe it's my ignorance, but I take my car to somebody who has been recommended to me as a source of valid car knowledge and repair, and I entrust them with my car. I got some back in my mind, are they going to charge me too much, all that sort of stuff. But I do not have the knowledge and skills to be able to make my car safe, let alone run, or let alone run, let alone be safe. So I think the same is true with areas of science and medicine, that people in science and medicine have one goal in mind, which is to uncover the truth through scientific work that's validated by others and over time. And I hope all of my colleagues in medicine have one care, which is to make those who are entrusted to care for safe, protected, and cured if they develop something. I'm a pediatrician because I love children. And I want to see them safe, and I do not want to see any harm come to them. I have no other factors in mind. And then there are organizations that focus their entire budgets and energy on trying to discover and display the truth. So irrespective of what one feels about government or government agencies, the Center for Disease Control and Prevention in the United States is world renowned for its ability to understand disease and develop prevention strategies, including what vaccines might work. The National Institute of Health, where Dr. Tony Fauci, who's commonly seen on TV talking about what should be done, the National Institute of Health is considered the golden entity by the rest of the world in terms of health and science. Hopefully, your personal physician, your pediatrician, is working on the basis of scientific data that he or she gets from these agencies. So I think you need to identify reliable sources, and I think one needs to entrust to those reliable sources. Verify talk to people. You're asking me, and I'm suggesting CDC, NIH, and there are many other entities. I think you have to develop some trusted sources to rely upon.
Absolutely, absolutely. So you say you're a pediatrician, obviously. So when it comes to kids and COVID and the COVID vaccination shot, I've heard kind of things go both ways. You know, my personal pediatrician said I would hold off on the COVID vaccination at the moment. That's what mine says. We're obviously back and forth on a lot of things. I'm obviously curious of your opinion, you know, from your knowledge, because we've heard it, you know, some COVID cases for kids it's just a common cold, right? And others, it can be obviously worse. So what's your opinion with kids?
The vaccine trials are going down in age over time to demonstrate that the vaccines are at least as safe in children as they are in adults. And the vaccines have turned out to be really safe. We can speak about that. And that they create the same protection in children as they do in adults. Getting down to your age children is probably going to be, you won't be making this or needing to make this decision until probably early next year by the time it gets down to your age children. In the meantime, you and your wife and your friends and your family can protect your children from COVID by getting vaccinated yourselves and sort of making a cocoon around them where they're not going to be exposed to the virus. But the good news of COVID for fathers and pediatricians and I'm a father as well, is that children have not been affected nearly to the same degree as adults in terms of how sick they get. Lots of children, literally millions of children in the United States have been infected with COVID, but the number who end up getting hospitalized or having severe problems is very, very low compared to, let's say, the other end of the age spectrum, the elderly, where most of the deaths have occurred since the start of the pandemic and over 80% of the deaths. So you won't have to make that decision right now, but I will be keen to encourage you when the time comes to have your children vaccinated, assuming the trials continue to go well in children, because it's like the other, when I started off saying all these vaccine preventable deaths in the world, it is a tragedy to me that a child may die, let's say in the United States, from an infection because they didn't get vaccinated against that infection.
So back to kind of the adult side of the vaccination shot, and like you said, there's a few different ones. What do you know about okay, the benefits of it, right? Is when you get a vaccination shot, can you take your mask off? Can you, you know, are you more open to go places? Is that okay? Can you know, is it something that you have to take again in a year from now, or is there a third shot? I've heard things about booster shots and all that. Where does that come down to?
So first of all, in the United States, and this, you asked this before, there are 3 vaccines which are currently licensed by the FDA under something called EUA, which is Emergency Use Authorization. The Pfizer vaccine, which is a 2-dose vaccine, 3 weeks apart. The Moderna vaccine, which is a 2-dose vaccine, 4 weeks apart. And the Johnson & Johnson vaccine, which is a 1-dose vaccine, and therefore no weeks apart. The Moderna and Pfizer vaccines, which are both called mRNA, which stands for messenger RNA vaccines, have proven to be extraordinarily effective, excess of 90+%, 95%. The flu vaccine, by the way, that you get every year, or hopefully you get every year, the influenza vaccine, is 50 or 60% effective. These are over 90% effective, which is really pretty remarkable against serious disease. Those 2 vaccines have now been given, I gather, as of today, to over 200 million US citizens, or at least 200 million shots have been given to about 150 million people. Some got 2 shots. And they've turned out to be really very safe. They do, or they can cause a sore arm, especially after the 2nd dose. They can cause people to feel tired. They can cause you to feel foggy for a day. They can make some people fatigued. All the things I just said are most common after the 2nd dose. and all are indicating that your body is reacting. And a reaction is what is being sought because it means your immune system is being trained. So they're very safe. There have not been serious adverse events for the most part. Some allergic reactions reported to people who have allergic reactions. And we could talk more about the Johnson & Johnson vaccine, but in answer to your question, they are really very safe. How long the protection is going to last is yet to be determined because the vaccines only started several months ago. So who knows if it's going to last several more months, a year, or forever. So that's being followed to see how your immune system continues and whether you get if you're vaccinated, you get infected a year later. That will all determine whether there needs to be booster shots, an annual shot. I doubt very much that there'll need to be an annual shot like the flu, because it's a very different kind of virus, but there may be. So we'll need to stay tuned about whether a third dose, if you've received 2 doses, is necessary or not. I don't know if I've answered all your questions, but please.
Oh, that's very good. That's very good. And I tell you, a lot of these questions, my wife and I were sitting on the couch last night and I was writing down a lot of these notes of, questions that my friends have asked me, my teammates have asked me, just it's kind of common questions now. Anytime you meet somebody, it's, do you get vaccinated? Are you going to do it? You have COVID yet? What's it like when you had it? Like all these questions that just keep coming up. One of them my wife had was about fertility, in the vaccination shot. Is that something you feel like is safe for women in the childbearing ages?
All of the data which have looked at pregnant women, of which there are many who have received a vaccine, there is no indication and there's no biologic reason why fertility would be affected. The vaccines, we haven't talked about the biology of the vaccines and it may not be useful to talk a lot about that, but the vaccines are not the virus and they're not some weakened form of the virus. They're little bits of instructions, either RNA related or DNA related instructions that don't get incorporated into our bodies at all. They simply are delivered to our certain cells. Those cells are then given the instructions to generate the immune response, the body's protection, and then those little instructions leave. Well, they're gone. So they're not like most of the other vaccines which are currently, not like any other vaccines that we currently receive. And for pregnant women specifically, the only vaccines or the vaccines that we worry most about, but even those are very safe, are so-called live vaccines. So measles vaccine, for example, is a live virus that's been weakened on purpose. Chickenpox is the same. So we don't give pregnant women, if we can avoid it, live vaccines, but this and the other vaccines that are available are safe and have nothing to do with fertility. That is not going to be it is not a problem and won't be a problem.
Absolutely. Okay, great to know. Great to know. So you talked a little bit earlier about all the, there's 14 different vaccination shots you can take, right, for your kids and all this that are available. And in today's world, for events that are starting to open back up again, people are asked to have their vaccination card. Where's your vaccination card, right? And that's for just COVID, right? Why doesn't that happen for, like you said, chickenpox or the polio or name it, right?
Right.
Is it because we're just in the pandemic right now? Do you believe that will stay forever? Or do you think that's something that'll, as COVID goes away and more people are vaccinated and it gets controlled like the rest of these viruses, does it just kind of go right into the list of vaccination shots like everyone else has?
I think it'll go right into the list. But so in many states, and I'm from Canada, so provinces in Canada, there are vaccine cards or electronic versions of them for all the different vaccines that you have received. You don't get stopped at the border, for example, to show your vaccine card. But when you start school, the parents need to display the child's vaccination status. And some schools, some states will prohibit entry if the child hasn't been protected. Most of of those other ones that you're speaking about, and as I said, the 14 you mentioned, most of those are diseases because of the vaccines are completely or mostly under control. There is no outbreak. There is very little risk because most people are protected. So the schools want to make sure everybody's protected in their school, but they're very low in the US. COVID, of course, is a very different circumstance. And we are developing more and more and more confidence that if you or I have been vaccinated, first of all, we're protected. We're not going to get infected, or if we do, it will be an infection that is ultra mild, not going to get a severe infection. And in all likelihood, we're not going to spread it to others, those at our house, those that we visit, those that are in more general gatherings. So part of the reason and discussion about people having COVID cards is sort of as things open up more and more, showing their evidence of vaccination will let them resume normal type life, more normal now than 6 months ago, and in 6 months from now, even more normal.
So different strands of COVID or of things that I've heard about. I heard there's another strand in the UK right now that is possibly worse than what we've been dealing with. I don't know if that's true. That's why I'm asking you. Is that something that we should be concerned about? And is that something that the vaccine will cover?
It's a wonderful question, an important question. So those different types are called variants. And you're correct. There's a UK variant, there's a South Africa variant, there's a Brazil variant, there's a California variant. So you start feeling left out if you don't have your own variant, I suppose. But viruses change all the time. That's normal. And the more of the virus that's in an area, a region that's circulating, just by keeping changing, these little variants always pop up. And some get survival advantage and they become more dominant, and others don't really change much and they just fade to black. And you're correct that so that's a shifting of the viruses. There has been a lot of work and continued work looking at the effectiveness of the current vaccines that we're all getting against both the original virus, which is, as I mentioned, extraordinarily high, and against the variants. And so far, touch wood, the vaccines currently being used really are effective, maybe slightly less, but not much less, at preventing the variants from spreading. So the current vaccines, because they are directed in helping our body identify something called the spike protein on the virus, which is where the variations occur, they're so good that they've sort of covered even the variant spike proteins. That may change, and everybody's watching them. And the vaccine manufacturers, because the platform that they've developed also is easy to modify for new COVID vaccines, and they are doing that. So there already is a variant vaccine that could be used if it became necessary. So it's like, I'm going to compare it to influenza. Although influenza vaccines are not, as I mentioned, as good. They're good, but they're not as good. Influenza is a type of virus that's programmed to change every year. It's just structurally that way. Most viruses aren't that way. Influenza is. So predictably, every year, there's a new variant, it's called something different, of influenza. So every year, to keep up, we should get that vaccine to prevent infections that particular year. So, and we do that in healthcare every year. And that's because the influenza virus has these more substantial changes because it's programmed to do that. So it's a long answer, but I have 100% confidence that currently we're in good shape. And if these variants become more substantially changed, a new vaccine, which would be a booster, will then direct us to protect us against that.
Absolutely. Okay, so if you've been watching this and you've learned a lot about the vaccination, I know I learned a lot throughout this moment, talking to Dr. Charles Prober. How do you sign up, right? Say you sign up, you want to get your vaccination shot, you want to get your vaccination card, you want to go back to normal living, right? You want to go back to life how it used to be. What is the best avenue?
For every state, the Department of Health on their website typically has a vaccine locator to direct you where you might go. It may be easier than that. Some employers, I should say, are setting up vaccination opportunities for those that work for them. I think Walmart has done that. Some other entities are doing it. There are pharmacies, drugstores around the country that have vaccines. But if you can't find it anywhere, your doctor should know too. If you can't find it anywhere, your government website will have directions in how to find the location.
Absolutely. Well, I know one thing. I have learned a lot here today. I know everybody here is watching, probably took in a lot. And like I said, all these are questions that you love to ask a doctor. And what I found the best doctor to ask the questions to. I know I feel a lot more educated, and I think that's what everybody wants to feel. Everyone wants to feel more educated about the decision ahead of them. And it's a scary decision, right? When there's something new that hits the market, when you're in the middle of a pandemic, right? Like we talked about earlier, there's so many, what if, so many people talking about it, conspiracy theories, all these different things. Yeah. All you want is truth. And I believe that you have helped me guide me in the right direction, hopefully countless others here today. I want to thank you and all the frontline workers that have been helping us get through this pandemic for over a year now. It's been just a crazy, you look at just life in general, how our lives have all changed over the last year, and seeing it, to you said, as you start to see the pandemic start to go down, that's because of a lot of hard work that some very smart people have been putting in to try to, find out the answer to this problem ahead of us, and also the frontliners that have been dealing with the problem, right with it next to the hospital beds. I just want to say thank you very much. Thanks for taking the time and educating us.
Well, Joey, if I might thank you back. I mean, it really is. I know you do a lot of philanthropic work. I know you have a focus on children. I've looked at some of your programs, which are truly remarkable and inspiring. And to use your notoriety, your fame, to be able to help your fans and other young families make the right decision about vaccination is inspiring and incredibly important. We have a center at Stanford called the Stanford Center for Health Education, which we try to put information up about this. We have a program called Digital Medic, which has a website with lots of information. And you and I think both owe a thank you to YouTube. We're working very closely with them. They are working hard to establish and promote reliable vaccine information so that the millions of people who tune into YouTube can see material which is credible. And that's how they identified you to me and maybe me to you. But I'm very appreciative of everything that you are doing and all of your team are doing. Thank you so much.
Thank you. You hit the nail on the head. Reliable. That's what we want to go for. Truth and reliable. So thank you very much.
Thank you. Pleasure meeting you.
You too.